Bismillah ar-Rahman ar-Rahim. The title of this article is The Efficacy of 4 Local Anesthesia Protocols for Mandibular First Molar with Symptomatic Irreversible Pulpitis, a randomized clinical trial done by Saber and others, published in 2021 in IEJ. About this study, the problem here is that the success rate of local anesthesia for inferior alveolar nerve block injection is vary from 42 to 43 in non-inflamed pulp. However, in inflamed pulp, this is reduced to 19% to 55%, according to Nostine in 1998 studies. And from this area, they proposed this study to examine the success rate of 4 different anesthesia protocol in mandibular first molar with symptomatic irreversible pulpitis. The null hypothesis in this study was there was no significant difference in intraoperative pain intensity and or heart rate change reported by patients with 4 different local anesthesia protocol used in the study. Basically, in this study, they have 4 groups. Those 4 groups has 40 patients in each group, and the first group was giving local anesthesia of 2 carbios, 3.6 milli, inferior alveolar nerve block. The second group was giving inferior alveolar nerve block 1 syringe and then supplementary intraosseous infusion using RA5 system. And the third group giving inferior alveolar nerve block 1 carpool, then supplemental periodontal ligament, and the fourth one was giving the same inferior alveolar nerve block, and then they were giving supplemental buccal infiltration with the articaine 4% with epinephrine. And then the result for this study that there was no significant difference in efficacy rate found in relation to gender and age. However, inferior alveolar nerve block and intraosseous injection has significantly higher efficacy rate. The efficacy was 92% compared to other techniques. However, the intraosseous lead to more raise in heart rate when they compare to other, and it was reported that 60% of the patient who receive intraosseous injection has that fast heart rate. And compared to other techniques, BDL injection with inferior alveolar nerve block give 72% success, and buccal infiltration 65% with no significant difference between buccal infiltration and BDL infiltration with inferior alveolar nerve block. And inferior alveolar nerve block alone was the least, and it has a success rate of 40% compared to other techniques. In conclusion, that inferior alveolar nerve block injection alone did not permit a pain-free treatment for mandibular molar with symptomatic apical periodontitis and with symptomatic irreversible pulpitis. The use of additional intraosseous supplemental injection provide the most effective anesthesia for patients requiring emergency treatment for lower molars, and the treatment of symptomatic irreversible pulpitis should be a pain-free, and this can be achieved by having a supplemental anesthesia to increase the chances of having the successful anesthesia. Thank you.